Okay. Hey, welcome. Welcome to The People Are Rising, the Social Determinants of Health, presented by Moving People to Action. I'm your facilitator, host, founder, Tim Clark. I want to welcome you. Thank you for tuning in to this much needed conversation around social determinants of health. We're live streaming this on Facebook and also on YouTube. And so we ask that you share your screen and get people excited about the conversation that we're going to have tonight about social determinants of health. When we look at life conditions that contribute to poor health, we will take a deep dive in terms of just places where we live, work, and play. We'll look at race, we'll look at gender and income. Believe it or not, that plays a major role in terms of just determining the social determinants of health. It's a factor that we need to look at. When we take a look at healthcare overall, in terms of healthcare outcomes, we will look at about 10 to 20% overall comes from healthcare outcomes. The other 80+% is due to the drivers is social determinants. It's life conditions that drives in terms of just our poor health and some of the inequities that we face with. And so I just really want to thank our panelists, Dr. Khan, welcome, Dr. Poor, Annette Smith. Thank you so much for taking the time to lend your expertise and your profound words of wisdom, in which we are all anticipating. And so that's a setup, right? That's a setup. But and so really what I would like to do is start off with, I want to get started because it's we got a lot of information that we want to try to cover, and I want to just really just jump in and let's get it started. What we'll do, the format is it's going to be open. I want it to be, we're going to have some discussion, and if there's some things that you want to bring up, let's do that. And so I want you to say hi, wave your hand, Dr. Ali Khan, so people can kind of, I know they can probably see your and as you're doing that, I think we're putting your title and all that stuff is up on the screen. Annette Smith, with the state of Nebraska, Executive Director, CEO of the Department of Health and Human Services, and Dr. Khan, College of Health, Dean of the College of Health. And then Dr. Poor, our Douglas County Director of Health in the Douglas County area. So with that, let me start off with the first question that I would like you guys to really take a look at. As it relates to what is happening right now, how do we look at what's happening right now? How does social determinants of health relate and impact this whole movement in terms of Black Lives, Black People Matter, this whole movement? How does it play in that? There's a whole lot of tension that is taking place in our country right now. And so just really, let's start off with just, how does that resonate with you right now? And anyone can start, okay?
Well, I can just start because I know the ones who are following me are gonna fill in. So, when we talk about social determinants of health, I think, Tim, first of all, thank you. Thank you for having me here tonight. And I'm looking forward to many more of discussions like this, because that's what we really need in our community. And so you are making the first step, and I hope this is just one of many.
Yes. Thank you.
But the first thing I want to say to your viewer, are you even realizing that in Douglas County, it matters in what zip code you live? there is like an 8-year difference if you live on the eastern part of Douglas County versus to the western part of Douglas County. To me, that is striking, and that should be upsetting to all of us. And so I think what this pandemic has really shown, it has shown what all of us knew, but it has magnified it. It has magnified it by showing the disparity in regards to death that we are seeing in this community also. And also it has magnified it in regards to cases that we are seeing. And then you have on top of it, Black Lives Matter, where you have potentially this trauma from police killings. So you have that on top. And then you have the pandemic on top. I mean, it is what we would call a tsunami, where everything really has an impact, and it impacts all of our mental health. And so social determinants of health, Black Lives Matter, pandemic, everything together, I think, brings us to this point where we are at today. So I would say for all of us, this is the tip of the iceberg that we are seeing. And so I think we all have a responsibility to really see what we can do about it. But this is kind of what I see when I hear those three terms together.
Okay. How about the other two?
Dr. Khan?
Okay. I will always take my cue from our CEO. Let me share a couple of quick slides. And now can people see my slides? Tim, do you see my slides?
Yes.
Let me share a quick set of slides to try to frame this. So I'm the academic here, and my job is to support people like Dr. Poor and the CEO Smith to do the real work in our communities. But since I am the academic here, I would be remiss if I didn't just give a framing conversation about Nebraska as a whole, right? So about 22% of the people in our state are a minority population. We have two really good measures of health in this state in terms of our drug deaths and our immunizations. However, we continue to have significant problems in our community with excessive drinking and obesity. And I say these because I'll come back to this later as we talk about public health in general. What we are going to see in Nebraska, that we're going to see nationwide, is over the next 30 years or so, there's going to be a shift in the composition of our population, so that by 2050, the US is projected to be a majority minority country. So more minorities will make up the country than a single majority. We are very fortunate to live in an amazing nation that has excellent healthcare and advanced specialized healthcare services. However, despite that, we continue to see poor health in America compared to other wealthy countries, decreased lifespans, and very significant health disparities. I can show you many such diagrams. There's no reason to pay attention to the bars. The point is that often African Americans, Blacks, Hispanics, American Indians do markedly worse in health measures here in the United States. And that has been true with COVID also. We know that death rates for Hispanics and Blacks are twice as high as they are for whites in America. And I'm going to leave it to my two clinical colleagues to share why Blacks and Hispanics may get infected more and then, of course, die more. Now, often when we see these disparities, they are often due to income. And so basically, there's no secret here. The more money you have, the healthier you're likely to be. It's no secret here. We know this. And I just pulled this curve out of respect for Dr. Poor when she mentioned that there was a discrepancy between the western and eastern part of her health district. You can see it's almost 10 years difference whether you happen to be born in North Omaha or whether you happen to be born in Millard. So that's right here, right? So that's a distance of, I believe, 12 miles or so. It's not very far. To see that sort of discrepancy right here in our own communities. As you mentioned, Tim, and I want to thank you at this point for inviting me to join this conversation. This is the passion for us at the College of Public Health to be engaged in our communities and with our clinical partners, Dr. Poor and Ms. Smith. So thank you for inviting us to this conversation. COVID is easy. When I say COVID, people go public health. But thanks to your leadership, you know, racism is a public health issue. Police brutality is a public health issue. Violence in our communities is a public health issue. And we need to think of these as public health issues if we're going to find better solutions. 80% of our health is due to socioeconomic factors, physical, environment, and health behaviors. That goes to your comment about 80%. So it's only 20% of us being healthy that's healthcare. And this 80% is what Dr. Poor and Ms. Smith work on, right? That's their job in our communities to working with community partners, obviously, not by themselves. This is a pretty little picture of different social determinants of health. And you know, often we say race and ethnicity is a social determinant of health, but I think we need to get out of this old thinking and recognize that racism itself is a social determinant of health, independent of race. And I think we're just starting to do that as a nation, recognize it as an independent reason for people to be unhealthy. These are the classic social determinants of health, but let me take you to probably a better slide, which is right here from your county. So this is right here in Douglas County. This is the work with the well-being partners, and 78%. So that's 4/5 of all early deaths in Douglas County. If you follow this backwards, are due to 4 chronic diseases: cancer, heart disease, lung disease, and diabetes. You follow it back to these health behaviors. You're not exercising, you have a poor diet, substance use issues, tobacco use, and then these are the social economic factors that lead to it. So if you want to address these early deaths in Douglas County, then you need to be working upstream here in the socioeconomic factors, right? Do people have access to food? Do they have access to preventive care? Do they have access to housing, transportation, right? Those are the things that are going to make have the most effect on improving the health within this county. And I could have done the same thing for the state. And let me stop here with how do we create healthier communities. This is sort of my recipe for more equitable public health within our communities. That includes leadership with shared responsibility, financial support for the things that we need to do, partnerships to make it happen. Please use data and metrics and the best science in what you decide to do in your communities. Make sure you have an equity and social determinant lens. But the most important thing, Tim, is you, right? This is our community members getting engaged to say, we are responsible for our health and we're going to make the systems work for us for our health. So apologies for if that was a little too long, but I thought with this way, everybody has the exact same vocabulary now moving forward.
So Dr. Khan, that is just perfect. I can think about Black Lives Matters a whole lot for me personally, because it's my children who are getting killed, and it's my children who are not having access to appropriate health care. And so when I think about Black Lives Matter from an administrative standpoint, I first go to how do I at the state level really help and endorse access to care. One of the things that I've seen throughout my career is communities of color having limited to no access to get to the hospital, to get to an emergency room, and all services being done in the emergency room and not thinking about prevention. And so how do we help communities begin to look at our health in a different way? I happened to be on a streaming show last week for one of the major churches in Omaha, and I talked about the impact of COVID on our community and how we don't understand our health wellness at all. We don't know if we're diabetic. We don't know if we have hypertension. COVID happens. The doctor is asking us about our health and we have no idea. And so we've allowed our cultural folklores to live. And so we won't go and get the influenza shot. And so how do we educate the community about access to care and then taking advantage of the care that is there and not allowing our folklore from our community to drive how we make decisions about our health? One of the things I hope to achieve while I'm here in Nebraska is really that community engagement piece that both you and Adi have talked about. I think that is the number one, along with access to care and being able to have the same supports as other dominant races, but it's really being able to access it, use it, and then the third piece to it is understanding it. And so while I'm here at the state, I'm hoping to look at how we do more community engagement, how we bring partners, not only the local public health departments, but those communities of color that need additional support to the table to help the state drive an agenda that looks at those health disparities so that we can figure out collectively what that looks like. So when I look at some of the statistics and why Black Lives Matter and why we see some anger in our community, well, African Americans, at least in Nebraska, tend to be unemployed at the rate of 11.2% compared to Caucasians in our state at 4.1%. When you look at poverty, American Indians are more likely to be living in poverty. And I know both of you all know this, I'm speaking to the choir, 40.5% more than Caucasians at 10.9%. And then when you look at household income, we know that American Indians are reporting the lowest median of household income at $25,000 a year compared to whites at $55,000 a year. So there's a lot of disparity. And when you think about Black Lives Matter, people immediately pick up on the inequities just to have enough to make things work for their family. And so how do we turn Black Lives Matter into something that I still think is positive, but how do we use that as a platform to talk about wellness and what we should be concerned about in our community? And I'm hoping that's what's going to happen moving forward. That's certainly the goal of the state, to see how we bridge those relationships, get everybody at the table, and really begin to talk about what matters most. And that's making sure that everybody can be well and understand their health wellness for themselves.
Tim, you're on mute.
Yeah.
I'm kind of used to kind of muting myself and unmuting, but thank you guys for sharing. One of the things, as you talked about this whole thing of racism and really looking and just taking that outside and deal with that all by itself, and then looking at violence as a social determinants of health, and really, yeah, I think what's happened in this country is a failure to have real conversation about what it is and what is not, and what we don't really want to talk about is the big elephant in the room, and that's race. And really, why should we focus on this thing called Black Lives Matter? They're in my ear. I need to move on. You guys answered some of the questions, but some of my next questions. But I want to get to the next one here. Is when we look at the work and the steps necessary to move and empower people to take control of their health, what does that look like? What does it look like as we look to inform, challenge, and engage people to move to action?
Well, I could start that off. I think one, it's an understanding of where you are. I think that.
There you go. Unmute yourself.
Uh-oh. Am I muted? I didn't think I was muted.
Go ahead. Can you guys hear?
Yeah, they can hear. So
okay.
I think one is understanding where you are inside of your health. I mean, Tim, let's be honest. For African Americans, it is very difficult to go to the doctor. and to really express where you are with some of your health challenges. That's been very difficult in our culture. That's one thing. And I think in order to change it, you really have to understand where you stand. That's number one. Number two, I think it's the use of data, and really data that's put in a way that people can understand why it's important. And I don't always think that at the state level, we do a good job in sharing what that data means and the picture that is describing for the state and for the local jurisdictions. And I think that's something that we've got to improve on.
I would agree with CEO Smith. And in addition, I think we need to start to look at policies.
So go ahead, Dr. Continue, Dr.
Because policies are the one thing that is going to make change. And we need to look back and see and learn from what was done wrong at one time. And we need to be deliberate. Because I recognize so often, we may have a good policy, but if we are not deliberate to be inclusive, we're not going to make a difference. And so I give you an example. There was a letter in the Pulse yesterday, about me that I wasn't inclusive in my board of health. I didn't have a representative from West Omaha on my board of health. And you know what I felt? This is my first win. I have never heard that the white Caucasians are complaining that they don't have enough representation. So, we need to be deliberate in what we are doing. And so I would say, and at the county, we are starting now to review policy after policy to see what are some of the outcomes that people probably didn't know when they wrote those policies, but it is policies that make change.
Dr. Khan. Dr. Khan, you're on mute. Can you unmute?
So
okay,
I'm going to have to up my game with these two practitioners on this panel with me. So let's start with policy. And I think that's a good place to start. So I'm also a practitioner in addition to my role as a professor here. And I started earlier talking about obesity and alcohol abuse within our communities, which clearly affect African Americans more within not just this community, communities across the U.S. and also Native Americans. So I can see a patient who's obese and say, you know what, I want you to go take a walk every afternoon, every evening when you get home. So it's easy for me to say, but have I thought about, are there sidewalks where this guy lives? Are there street lights? Are there curb cuts? Is there green space for this person who I just said, go take a walk, right? Right. So this is about those social determinants of health, of how have we put sort of institutionalized sort of racism policies without ever realizing that perpetuate racism with some of these policies. And so I agree with Dr. Poore completely that we need to step back, look at our policies, make sure there's health in all of our policies. And yes, we need to dismantle old policies, but all new policies, we should have a health equity lens for all new policies and say, is this going to be equitable or not? So at least, don't create new ones, right? I guess the first step President Clinton used to say is if you're in a hole, stop digging, right? So let's just stop digging some of this. Also, I can tell you an example. I go to visit my godmom up in Florence, and in a 2.5-mile stretch, there's 8 liquor stores. What 2.5-mile stretch needs 8 liquor stores, right? How do we fix policies like that?
Right. Well, so as we look at trying to wrap this segment up, what can we do to better the situation around? I mean, I know we talked about racism, violence as a public health crisis in our community. Just real quick, maybe point to some things as our viewers and listeners maybe some the points that you would bring forward, and then also talk a little bit about policy. But sometimes I know these things are bigger. These are big things that we're talking about, and sometimes it's going to make reason for policy changes. And then also we have an election coming up. I know we want to stay. We don't want to be political, but really the power of the vote. How can that impact? So just kind of expound on some of those, policy, and then really down to the root in terms of the racism, violence, it's public health crisis. But we drill down in terms of some practical things that people can take and do something about.
Well, let me start, and then we'll go in the other direction this time then. Let's actually start at the top level, which is vote, right? So see who your candidates are at local, state, national level. See who's going to best meet the community interests of ensuring that there are good policies that are going to be put forward that are going to address health inequities, that's going to address racism, that's going to address violence, that's going to address police brutality, and vote. Not enough people vote to make a difference. And if everybody shows up at the polls to vote, you can actually make a big difference in who gets elected. The second is there are some amazing organizations within our communities that are working on these issues. I mentioned earlier Well-Being Partners that is working on food deserts, and some transportation issues and mental health these days. So find these the Empowerment Network. I could go on and on about those great organizations with join, right? Be part of them and help work within your community. So that would be, my 2 suggestions.
Okay. Anybody else?
I think the same thing as Dr. Khan says, and in addition to, get involved with community advisories, be a leader in your community, and also foresee how can you better your community by potentially choosing the education that really helps your community to get further. And that's probably more for the younger people who are choosing what they want to do in their life. But we need good leaders, and we need leaders in the community, because only those are mentors that people can look up to. So those will be some of them. And even so, policy changes are big, as you said, Tim. They actually also can be very small. And small changes can make big differences. So I would not discourage anyone to get involved and really let their voices be heard. Communication, outreach, we know that is so important in those in every community, but more so where people need a little extra help and assistance.
And I guess for me, I would say, one small step is really understanding where you are in your community about your health and the health of your community, and being able to share that. I really liked what Dr. Poore and Dr. Khan said about policy. I think that policy now has to be intentional. It has to be realistic and not policy for policy's sake, but policy that drives results to help people be better. And I think sometimes we create policies for just being a policy, but we're not creating policies that have a benefit for the persons that we're trying to serve. And so I think that those are things that are very important. And being active, understanding policy, being able to interpret it in your community. I mean, one of the things that I find only in my community, and certainly yours, Tim, is that we don't always understand what policy is. And we don't have anybody to interpret it. And we need people like us to come out in our community and talk about the kinds of policies that we're implementing at the state level, so that at the community level, people understand why they need to go to Douglas County and get certain services. We don't understand that. And so sometimes that has set us back because of our own fear in understanding and then acting inside of policy.
No, that's a very good point you bring up in terms of just not understanding policy. So maybe the challenge is from the three entities that we begin to put forth some town hall meetings or some seminars in terms of workshops on what one of in the chat there's a question, and basically it was around policy. It says how come policy is not developed from the people that suffer the most? And so it's really it's a process of collecting and listening. And so I would welcome even using this platform as a platform to shape and mold policy, that we can begin to change some of the negative discourse of some of the conditions that cause poor health in our community. So as we go to this last round, I want to take the time in terms of if there's folks out there that have any questions, if they can go ahead and put forth those questions now, and we'll try to ask the panel to cover some of the questions. But that was one of the questions: how can we get more grassroots people involved in writing some of the policies, Ms. Danette, that you speak of?
So Tim, I think one of the things that we have to do a better job, and I'm going to just speak for my relationship here at the state and other places that I've worked, we've got to be willing to be more community-based. And of course, people will say at the state, that's impossible. I don't believe it's impossible. I think if we want to develop good policies that are real, that people can understand and then participate in, we really have to hear from the people we serve. So I think one is really just taking a community-based perspective, listening to what the community is telling us. And not the community doesn't just mean our local public health departments or the FQHCs, but I mean actual people in the community. I would love for us to be doing more partnership between the local public health departments. We do around COVID and many other things, but we haven't had listening sessions since I've been here. Now, Dr. Poore probably has done some in Douglas County. I'm sure she has, and so has Dr. Khan. But I know from my agency, we don't do listening sessions. And listening sessions are a really good
that sounds
tool.
like an action item there.
That's an action item.
Because this platform is all about moving people to action.
Yeah,
okay?
it's so really.
So please note that one. We're going to be listening. Okay.
So listening sessions are really good ways to, one, listen to how people feel about health equity issues, but also for us to glean what is most important to the people that we serve. And oftentimes government doesn't allow itself to be in that position of listening, taking it in, and then figuring out what the corresponding policy needs to be to it.
Yeah.
And where I've worked in other places, that has been a very, very helpful tool.
Yeah. And I think when people, they know that you're listening and it's sincere, I think then that's the only way to really create some cohesion and efforts around it, that you have people that are suffering, they're in it, they feel that everybody's in it together, but when you don't take the time to listen, and I think we're, I don't know about you guys, but I think we're at a critical crossroads in this country where there's a whole lot of empathy, and now how do we move that to work and to action? People want to roll up their sleeves. They want to work. They want to work. And I think all of this energy, let's turn this energy, and some may say it's negative, but let's turn this energy into some things that we can have some substance and go deep. We got to go deeper. And I know we can. I think we have, the three of you on, we have some other panelists that's coming on. I think, especially in Nebraska, we have the resources, we have the talent, and now is the will. Do we have the will to really take a look at racism as a public health crisis, violence as a public health crisis, right? And looking at police and community relations. When you think about, and I know Doris Moore, she was supposed to be on, and she had a family emergency to talk about the mental and behavioral health. I need to be on drugs. I mean, when you think about what's going on and what we got to process every day, oh my goodness, it's crazy. Do we have any more questions? Let's see if, let me see. There's another question here. Okay, is this, do you have it in the chat?
Tim, for the one that is in the chat that talks about how can policy be developed from the people who suffer the most, this is a really important link back to your county commissioner and your state senators and others, your school board, right? That is where these policies are made. And it's important to stay knowledgeable of what's going on in those venues, talk to your representatives and make sure that your interests are, taken account of. And, we don't think about this. I know I never did. It took me a long time to think about this. But if enough people go to their representative and say, this matters to us, that representative will be swayed to, what position is held by the majority of the people in the community. But if they never hear, it's really, the loudest voice that, gets the vote.
And to your point, Dr. Khan, that's why in terms of these town hall meetings, the theme is the people are rising, because but it's so true in terms of just, it's like we've been asleep, but we've always had the power to drive anything we want to drive, but in terms of the will to get up and really make sure your voice is heard, to do about and be about the change that we desire. That's really, really the question and the answer that we have to answer. We'll take one more. I see one other question on here. Is there any other questions coming through on Facebook? Are we asking them on Facebook if there's any questions? Somebody talk to me.
And while you're waiting for somebody to talk to you, I do like this idea of a creative disruption, right?
Oh, I like that.
Right. So how do we take what's going on in America now for a better America? We did this 50 years ago. We'll do it again. Some of my friends outside the US, they shake their head at us and I go, nope, it's just a metamorphosis. We're going to get better in the next iteration of America. But how do we get better in that next iteration of America? And, with due respect to my practitioner colleagues, if you start looking at racism as a public health problem, police brutality, violence as a public health problem, what that does is it says there's new solutions available for you that weren't available when you looked at violence as a law enforcement problem, right? And I think that's where it's important to be engaged with your health department on the board to say, how do we look for newer, different solutions than what we currently have?
Dr. Porter, you have anything you want to add to that before we wrap that up?
No, I think it was said all. I think more engagement, more of these discussions. And even in these discussions today, we haven't heard really from the people who are on tonight. And that's really what next time, we can hear ourselves talking all the time. But I need to hear from what really keeps you up at night? What keeps people up? What is concerning?
Yeah. And hopefully, in terms of to that point, Dr. Poor, through the live stream, that people will voice their concerns and questions, and then if you guys could, if you could put in the chat in terms of just if folks want to get a hold of you guys, that's a way they can do that. So put your information up there. But as we look at this whole thing of looking at violence, racism, and all these things that you guys talked about, I think what it forces us to do is take away the law enforcement just only strategy of dealing with violence, and it forces us to look at it from a health perspective, holistically, that there's multiple strategies at dealing with some of the social ills and some of the challenges that we're dealing with racism and violence. So in closing, And then hopefully I welcome you guys to stay on, and you'll be able to hear some of the other folks. We have an African-American male nurse, that is head of nursing for CHI, a CEO, executive director of Lutheran Family Service is coming on, and Dr. Richard Brown, the work that he's doing with Creighton University, a program called REACH. We'll hear about some of the things that they're trying to do proactively. So feel free to stay on as we end this session. We will have a little short commercial break. We do got to pay bills, so that's how we pay bills. So we're gonna have a little break here, and then we'll come back and bring on our segment 2 panelists. In wrapping up and closing, let's start with if we would, Danette Smith. You got less than, this is kind of your elevator. I'm putting my chamber hat on when I used to be a work for the Chamber of Commerce. You got 60 seconds in your elevator speech, but this tells in 60 seconds really way forward as we look at our core subject. What just leave them that little kind of that thump upside the head, or whatever you want to do, that awakening.
So I think you said it well. It's an awakening, but people have to get involved. We can't do it for you. You have to get involved. You have to ask questions, and you have to participate in the process. And I think what our nation is going through right now is that you cannot not participate. It's to your benefit to participate and engage and be a part of the change that you want to see. You got to be a part of the change that you want to see. You can't talk about what other people have done. You have to talk about what are you prepared to do.
And part of what I think what you're getting at too is somebody alluded to, know your numbers.
That's right.
Know your situations.
Know your situation. That's correct.
Do you have a medical home? Right.
Right.
That's
correct.
Okay.
So the days of the days of blaming other people.
I took some of your time, so
got it.
I don't want to steal Dr. Poor's time. So 60 seconds, Dr. Poor.
No, just recognize that you live in a great community that has a lot of collaboration going on. And so it is easy to be a part of collaboration in this community, but you need to get out. You need to be positive. You need to bring solutions to the table. And that's what I would encourage everyone.
Thank you. Dr. Khan?
I'll do a version of the same thing since they were so eloquent. So what I would say is that everybody who's listening to me, you have the power right now today to impact your own health in terms of your decisions about exercising and eating right. You have, and the same way you have the power to impact the health within your communities. Use that power to improve health in your own health and health in your community.
There you go. Hey, thank you guys so much. I appreciate it. And this is only the beginning. And I like where you're heading, Dr. Poor, in terms of just, we want to make room to have people in terms of grassroots, total involvement and engagement. So we're hearing from other folks that are out there in the field as well. And so we will seek to do that. And thank you guys so much for taking the time.
Thank you.
Thank you.
So we're gonna transition now with a little commercial break, and then we're gonna transition our panelists for our second half of the show. I like those slides.
Peace, my brothers and sisters. Take control of your life. Exercise 3 times a week. It's smart and join the fight.
Hi, I'm Dr. Richard Brown, Executive Director of the REACH program at Creighton University in Omaha. REACH stands for Racial and Ethnic Approaches to Community Health. The approach is clear and simple. Take control of your destiny, get healthy, get wealthy, and exercise 3 times a week at a minimum until you sweat.
Take control of your destiny, be brave and have no fear.
My name is Avon. Since I was 3, I was living with just me and my mom.
Mentoring has had a positive impact on Avon's life in so many different ways.
So Avon has been matched with me now for about 6.5 years.
Having a mentor helped him trust people.
I feel like I can talk to him about anything. it's just amazing the type of impact that you have that you may not even know that you're having.
Having trouble paying rent, mortgage, or utilities because of COVID-19? Lutheran Family Services of Nebraska can help. Nebraskans who are struggling with bills because of COVID-19 may be eligible for financial support through the CARES Act. If you need help with rent or mortgage, basic needs like food and utilities, or know someone who is in need, visit us at lfsneb.org/caresfund. Again, visit Lutheran Family Services at lfsneb.org/caresfund.
But now you've heard it's a good idea to wear a face covering in public.
Please do not take it personally.
Your mask protects me, my mask protects you.
But here's the key. Make sure it covers your mouth and nose.
Like this.
It's easy, Douglas County, so please wear a mask.
Welcome back. Welcome back. It was a delayed one in terms of in my ears, so I had to say welcome back twice. It was kind of delayed there. But welcome, you guys. Thank you, Stacy Martin, and Dr. Richard Brown. Thank you so much for joining us and taking the time. Can everybody take your let's take your sound off mute so we can just test our mics and everything like that. Stacy, hi.
Hi, thanks so much for inviting me. This is
Hey,
great.
you're welcome. You're welcome. Dr. Brown.
Yes, I'm here.
Right on, right on. I see your background, all those colorful hats, man. What are those hats in the background?
Well, yeah, you know, they pile up in the closet and they get all piled up and you say, well, what could I do with these? Well, let's put them on the wall.
Okay. Well, we're gonna go ahead and get started. We're waiting for. I think they're going to be trying to bring on Greg Williams. I don't see him on. Let's see if he's in the gallery here. And so we'll bring him on when he shows up. So we're going to go ahead and get started to kind of keep things moving. For everyone. So, hey, this is so did you guys get a chance to take part in the first segment one? Did you hear some of that?
Yes, I did.
Okay, awesome.
Great.
Well, first of all, is there anything that you heard that you just Stacy Martin, I think we're going to put on the screen in terms of just CEO of Lutheran Family Services of Nebraska, and Dr. Richard Brown with Creighton University, REACH. Dr. Brown, REACH, just real quick, what is REACH?
Well, REACH is an acronym that stands for Racial and Ethnic Approaches to Community Health. This is a program that was funded by CDC. Funds are no longer with us now, but it was all about attempting to decrease the chronic diseases among the African American population in Omaha. And so we focused on one particular element of improving health, which is physical activity. So we spent lots of time developing messages, and walking trails, and newsletters, and did a lot of things just focusing on getting African Americans to value participation in physical health. And of course, education is very, very important. There's a lot to be learned about what physical activity can do for you, which is we talked a lot about, and I think we won some minds and hearts over the 3 years that we did that. Now we're focused on, COVID-19 and delivering messages to the vulnerable population at this point.
Okay. And Stacy, for your organization, for ones that don't know in terms of just mission purpose, why don't you just kind of high level give us that 60-second little stump speech there.
Yeah, so for the purposes of this evening, when you think about healthcare, there's your primary healthcare and everything that deals with your physical health, and then there's all of the social determinants of health. And it's along that spectrum that Lutheran Family Services work. So we not only provide services, we work to create some systemic change so that health and well-being is accessible to everyone in our state and region.
Right on. Well, let's get to the first question here, and really, with a play on COVID-19. In so many ways, it's forced us to rethink, reimagine the variety of the impact on social determinants of health. What does the new normal look like for public health, and particularly your organization, or just in general, as we reimagine, rethink in the midst of COVID-19? We know that it's having some profound impact in terms of your organization. Stacey, you want to start with that?
Sure. Well, that's a tough question, so thanks for that, Tim. And thanks again for hosting this panel.
Well, thank you guys. Thank you.
Sure. Yeah, I wouldn't say that COVID-19 has forced us to rethink about the impact of social determinants of health, because that's what's been thought of and talked about for years in the sector. But I think what it's done is opened up an opportunity to reframe the problem of public health and how the social determinants of health affect public health and individuals' health in a way that we can't blithely ignore, because it's on the universal stage. So I would say that in the same way that the Black Lives Matters movement has created a reckoning as it relates to inequitable systems in the criminal justice system, the same is happening, or should be happening, related to the inequities in our healthcare system because of COVID-19, what's on display.
Dr. Brown?
Well, Tim, let me say that I do appreciate you inviting me to this town hall. I very much enjoy discussing issues of the day, and have been in healthcare for 35, 40 years here. So I've seen a few things, so I know a few things.
Okay.
To quote State Farm. But I think what's going to happen going forward with people in general, and hopefully with the African American people in particular, we must really focus more on our individual health and focus on understanding, how to stay healthy. We must concentrate on getting greater education for ourselves in terms of, as you mentioned in the earlier segment, know what your numbers are, understand what causes high blood pressure and heart disease and obesity and depression. And so I think that that there's going to be a greater focus on looking at those things. I taught epidemiology for about 8 years back, 20, 30 years ago. And at that time, that was when DRGs was coming along and managed care and all of that. So I used to say to my class at that time, the world and America with this healthcare delivery system is coming to a point where you are going to have to take control of your own destiny and make sure that you understand how to be healthy, because the healthcare delivery system is not going to take care of you at the level that you can take care of yourself once you become educated about how to do that.
Thank you, Dr. Brown. And I want to welcome Greg Williams. Welcome to the panel. Greg, how you doing, my man? Just when we take you off mute.
Hey, I'm well, Tim. Thank you very much. I'm doing very well. Thank you for having me.
Hey, thank you. So if you could, I don't know if you got a chance to hear the question, but really just, first question in terms of, in light of COVID-19, especially with you being in the health, you serve as the director of nursing for CHI. And so COVID-19 has in many ways forced us to rethink, reimagine what health care systems look like, how do we play, and think about it. Just kind of how does that resonate with you and the work that you're doing, especially in the trenches? You're in it.
Right, Tim. And so I think, COVID-19, like any other viral illness that we see with this type of grasp, I think what it really just highlights is the health disparities. So what we see, while we see people of color, minorities who are having disparately larger numbers of deaths and illnesses and with COVID-19 is those underlying medical conditions. As Dr. Brown stated previously, I think when we don't take care of that high blood pressure, when we don't get counseled about tobacco cessation, when we don't take care of our diabetes, it's kind of like a house of cards. And so when we have these untreated, undiagnosed, behavioral or medical conditions, I think when we have something like COVID-19 that sweeps through our community, I think it, it does what it was, birthed to do, which is impact greater those who are not well. I think the biggest challenge will be about kind of decloaking some of those myths as we, of people of color, get into a posture where we can seek care. I'm from the South, probably can tell from my accent. But
welcome to this place we call the good life.
Thank you. It's good. It's good to be in the good life. But I was raised by my father, who was raised in the South, and so things like the Tuskegee syphilis experiment. I mean, these things still resonate in the consciousness of a people who generally, are not very trusting of healthcare. And so I think, in my role, my goal is to reach back and to really help those who can become the face of a new healthcare delivery system and really start to push that envelope for diversity and inclusion as we not only become the patient, but we in our communities really become the caregivers and care deliverers also. Thank you for letting me share.
So when you look at that, on top of that, how do we meet people where they're at to help them deal with some of the root causes of social determinants of health? How do we meet them where they're at? And then anyone, now we're gonna play where, hey, ready, set, go. If you feel it, just go in and jump in. Just be kind of like CNN. Just let's just go for it.
Let me say that one of the most vulnerable populations across our country, and specifically in Omaha as well, is the public housing system, which has thousands of people at the grassroots poverty level, and in some cases educational level, economic level. And so what we've done both with the REACH program from 5-6 years ago to where we are now with the COVID is we have absolutely decided to go to the people where they are. So we've set up and trained, I think about 48 community health ambassadors now. And many of them live in the housing complex. We've done the same thing with about 12 churches. And so we've taught them about physical activity and chronic disease and helped them understand that. And they have become certified community health ambassadors. And so that's one way to go to the people and educate them, where we find them. And it's been interesting. It's been a very interesting experience. It's been very rewarding. We know that people have improved their health as a result of our involvement, because nobody else ever came to them and talked to them about how to stay healthy and be healthy and to be able to respond and protect themselves against COVID. So I think that is what you do. You got to have funds, resources to go to the people as to where they are and provide them with education. Unfortunately, education is one of the major weapons that we have for improving health. And unfortunately, the population is bombarded by messages from other sources that counteract what it is that we're trying to teach and train all the time. And we can get into talking about the food commercials and the medication commercials that are on TV all the time, every 60 seconds. So we have to do what we can, where we can, by getting to the people individually, independently, where we find them. And so that's what we tried to do.
Yeah. And hopefully, we take on that attitude. The more they know, the more we inform them, the more what you're talking about, that they have that opportunity to control their own destiny when it comes to their health. And Superman is not coming. I think you talked about the breakdown of health system. It's just, we got to take our health in our own hand. Okay, go ahead, others.
Sure. Well, similarly to Dr. Brown and his team, Lutheran Family Services goes out into communities, and we've continued to offer mental health services in the context of community and over modalities that we wouldn't have, or we did, but not as broadly as we do now with COVID-19, and have expanded services so that we're offering them in a variety of languages and attending to diversity of cultural norms and trying to be as culturally humble as possible. At the same end, besides working within the context of communities and with individuals, we have Lutheran in our name. And Lutheran congregations happen to be some of the widest in the country. So we're also taking stock of what it means to be Lutheran in a context in which Lutheranism hasn't always been helpful in dismantling, and certainly has had its own part in establishing the status quo. So trying to work with individuals and at the systems level, and understanding that the only way that we can build equitable communities is to move past upstream initiatives and to look at groundwater approaches so that we can have the collective guts to come to real terms about how each of the systems at play along the social determinants of health, housing, employment, parks and green spaces, transportation, I mean, you name it, education, and the healthcare system, how each of those systems advantage white folk over communities who've been disadvantaged, and really thinking through what it is that we're doing so that we're not contributing to the status quo. I mean, the World Health Organization warns that conflating the social determinants of health and the social processes that shape those determinants of health in unequal distribution can seriously mislead policy. So thinking about the first panel, not only working with individuals, but making sure we're advocating for and really bringing forth policies that dismantle the systemic racism that's at play across every conceivable system that affects health.
Right on.
Wow, Stacey, very, very, very good points. I work for Catholic Health Initiatives, which is obviously a Catholic organization. I'm not Catholic, but one of the reasons I, have chosen to continue to work with that organization is because it views itself as a ministry. I think, to Stacey's point, there's been a bit of a reckoning where we've kind of come to realize that diversity and inclusion is a real thing. Not just from the patient population, but from the caregiver population. Black folk need to be cared for by people who look like them, and to see those people as authorities in their respective rights. But I think there's pretty much a four-pronged approach to really addressing that whole disparity of care. So I think there's education, number one. Of course, Dr. Brown stated that very well. There's access to care. I think there's inclusion. And then I think there's also a cultural stigma associated with assuming care. I'd like to talk a little bit about each of those things. So I think the education piece, I think the education is not just about educating patients, but also about creating those opportunities structurally to really welcome minorities into that healthcare education space. How do we get people from North Omaha campuses or high schools interested in careers in education? How do we leverage my role as a leader in healthcare to reach back and help others to join the ranks? The other piece I think is access to care. I mean, just, if we look at the disposition or the dispersal of healthcare organizations in Omaha, I think we'll see that those are more affluent areas tend to attract healthcare. I think there's in the North Omaha area, I know we have Emmanuel, which does wonderful work, but really we don't see, I live in Gretna. And so here within 5 miles is probably 3 or 4 hospitals from my house. I think the other thing is that inclusion piece. I think we have to start to have that dialogue with our communities about what care looks like, bringing our community leaders into our healthcare systems to really make those things available. And last thing I think is something that we as Black folks have to own, and that's that stigma. That if we go seek help for a mental condition or for a chronic condition, there are those stigmas about, the machismo of the African-American male. And if I get my high blood pressure treatment, I may get the beta blocker blues. Or if I go and get treatment for that depression or that bipolar disorder, well, people will say I'm crazy. And so I elect to self-medicate. I take marijuana, I take alcohol, I take whatever intoxicant is available in my immediate area. And I think those four things, those are the biggest things that, we need to tackle to really kind of move the needle on this.
I know. And you guys, you answered a little bit of my next question in terms of just things that people can do around empowering themselves and the community for solutions. So let me go to the next question. From your perspective, your level of expertise, what are some of the meaningful steps that we can take to improve public health inequities and the effects of institutional racism? Who wants to?
That's a huge question, and
I mean it's kind of big. I know we don't have enough time, but let's just why don't you tease them a little bit, Dr. Brown? Let's enough time to tease a little bit.
Okay, let me start with something that's been very, very dear to my heart, and that's the Affordable Care Act and the expansion of Medicaid. Okay, that's something that could be done, have been done in 39 states, and should be done to improve the health of individuals. Now we know that the law was passed in 2010. Okay, and only about 35 states expanded Medicaid. Nebraska was not one of them. The other states, about, like I said, 12 or 15 were the southern states pretty much. And you can look and see the Republican controlled states of those that were not in favor of expanding Medicaid. Now, Nebraska just now expanded Medicaid, at least, and now it can be implemented. But it's been 10 years. There's 245,000 uninsured people in Nebraska. How many?
How many?
245,000 people who are uninsured in Nebraska. So between 2010 and 2020, how many of those people who do not have health insurance died from their high blood pressure or their heart disease?
That's real talk.
I mean, it's just criminal from my standpoint that we have politicized healthcare, in this country. And again, we could go on and on and on, because when you ask about what are some of the solutions and what should be done, there's the big pictures, such as expansion of Medicaid in all of the states is what should be happening. And of course, we need universal health care. People on this planet, and specifically in the United States, should have access to health care. And we know, being in the field, all of us, that healthcare is only a right for those who can pay for it. And it should not be.
That's not right. That's not right.
No, you shouldn't have to, your health and your life should not be dependent upon whether or not you can pay for health insurance. And that's a political, capitalistic system that has been put in place. It's not in place in some other places, but it's here because of the system that we have. And in general, when you talk about how do you change and what should be done, you have to change systems. Now that's a big job to do, a big job to change systems. But I think it was Stokely Carmichael that said 55, 60 years ago that in order to eliminate racism, you have to develop a new system. Now that's huge. That's too big for most people to.
No, that's a whole nother town hall.
I understand. So I'm going to stop there and try to stay on point here.
Let's have the other two kind of weigh in on that as we begin to wrap up this session. But now you guys are going to stay around. We're going to take a break. and I want you guys to stay around so we can continue the conversation.
Yeah, I would agree with Dr. Brown. I mean, it starts with understanding how things got this way and explicitly addressing the systemic imbalance of power and advantage in our approaches, not only to health equity, but in all of the intersections of systems at play. As I mentioned previously, we can't simply accommodate people in systems that were never designed for them in the first place. I mean, that is inherently inequitable. And if we truly believe that everyone has a fundamental right to the conditions of optimal health, and we should, we'll have to face our nation's history, and we've got to acknowledge the intentionally designed racial hierarchies and their connection to power. And it's only then that we'll be able to really commit to healing and building new systems of equity. And that has, you know, there's a lot at stake in the white community, and it means that there's got to be a reconfiguration of the whole playing board of what it means to live the American dream and to live the American way. It's not easy, but it's essential.
Yeah. Okay, Greg.
Yeah, so I think, and I'm going to, just